name's Todd Mitchell. I am I'm the Chief of Psychiatry at UC Berkeley, and I am going to talk to you in an abbreviated fashion, because of time, about a system that I designed with the IT staff at Berkeley for curating secure messages as they come in. So I'll give you a little bit of history as to why we decided to do this. Back in 2013, I got notified by the IT staff that Point and Click has a secure messaging feature. Isn't that great? Students can message you whenever they want to now. We're going to turn it on this date. And everybody was very excited. And my hair, little hair that I have, stood up straight. Because I was thinking, what is this going to do to the therapeutic frame? What is this going to do to our ability to attend to all of these multiple incoming streams of information, some of which is fairly clinically acute or can be? What's it going to do to staff morale when they feel like they've got to check, this device and that device and that device and that device, when they're used to really just coming to the office, sitting down and seeing patients and writing their notes? So I was concerned, and luckily our IT staff at Berkeley is awesome. They're really, I can't say enough nice things about them. And they worked with me, taught me a bunch about designing web pages, taught me a bunch about how to get what I could conceptualize clinically, I felt necessary, into the realm of web design and computers. They were really, really helpful. I thought it was a good example of us being able to bring our expertise together and create something that works pretty well. So the learning objectives today, you've probably seen already, but we're going to talk a little bit about the philosophy of why we decided to go away from a free text model. And then we're going to talk about the 4 types of secure messages that can be addressed with effectiveness by clinicians using the system that we designed. We'll talk about how this enhances efficiency, and you'll also along the way learn some nifty web design terms that you can use at cocktail parties, or when you go back to your campus and you design your own system. Okay, so anytime clinical access is a new thing. I think each new generation or each new half generation that comes out wants more access more quickly. And in some ways this is a good thing, I think, for people to have more portals and more ability to get access to healthcare is definitely a good thing. It's one of the things actually that David Satcher, although I don't think he was talking about this, back several years ago was talking about increasing the healthcare of the country in general by increasing access to healthcare, especially to people who don't have a whole lot of access. But there are some risks or some potential problems with anytime access. And I use the term anytime in contrast to real time. Real time is like pick up the phone, you call your doc, you call the clinic, or you show up at the clinic for your appointment, or you walk into the drop-in clinic. Those are all real-time interventions, real-time encounters. I'm talking about anytime, like email, secure messaging. You can get up at 2 o'clock in the morning and send your clinician a text message. I'm standing on the Golden Gate Bridge. I don't feel so good. Call me now. Right? But it's 2 o'clock in the morning on a Sunday, and I'm on vacation for the next week. I'm not going to see that message, and that's a problem. The issues about staff morale I mentioned, patient confidence. If the patient has the expectation that you're going to respond to their secure message immediately or within an hour, and you don't, they're going to have concerns, and they're going to lose confidence in the clinic. The therapeutic frame I mentioned before, and also liability risk also comes into play. So we need to be cautious not to encourage virtual encounters instead of real encounters. And we have had patients who I think are rather bright and rather savvy and try to game the system a little bit, where they'll set up an appointment, call in, ask for a refill, get the refill, cancel the appointment. And if someone does that once or twice, maybe you say, maybe they just did that once or twice. But when it becomes a theme, then that's something that you want to attend to. And I think our system does that. So the psychiatry service has a different secure messaging model than the counseling unit. We have 2 units in CAPS, the psychiatry unit and the counseling unit. The counseling service basically does it this way. They have a free text box. And if you have a concern, write it in here. When the patient clicks send, it goes into a mailbox that's looked at by our clinical director, and she does the triage on it. She figures out what the student is asking for, what they need, and who it should be delegated to. So the problems with free text boxes is that anything goes. You can get anything in there, from a manifesto to an inappropriate comment to an inappropriate request. You can get anything in there, and our poor clinical director has to look at all of these, read through them, even the dense ones, where the clinical bullet is buried inside and intertwined with a bunch of other information, and figure out what to do. That's inefficient, and it's also torture for her. So it becomes labor intensive. As I was saying, important clinical information can get buried, and the poor patients don't have any guidance about how to communicate what their needs are, and they don't have anything to gauge their expectations of response on, which isn't really fair when we're talking about people who aren't necessarily savvy about how healthcare systems work, but need to be savvy, and we're actually the proving ground for them. We're training them how to be savvy about their healthcare. So I think they need a little bit more guidance. So in developing the system, I applied the following clinical philosophy. That increasing access to healthcare is a good thing, but when we get these technologies, we need to apply them thoughtfully. Some aspects of the triage and response can be automated, and the idea behind this is that a computer should be a labor-saving device, not something to enslave you. Maybe I watch the Terminator movies too much. Workflows can be developed to manage and respond to the inbound secure messages in an efficient way. This is an important part, and this kind of goes directly against the free text box, that there are only a certain few requests that can be effectively managed without actually seeing the patient or having a real-time intervention with them. And I'll talk about which they are in a second. And then limiting the inbound content to those appropriately actionable categories actually is a triage function. So we've got our computer here doing our first triage step, and then it'll go to a clinician thereafter to do the more nuanced step. So the following categories are the ones that we can action effectively: scheduling issues, routine refill requests, not complex ones, and non-urgent medication-related questions. Anytime clinical communications have to be clear about your limitations. When am I going to get back to you? What should you do if you're in crisis or you're having an urgent issue? All this needs to be mapped out and laid out very, very clearly so that you don't have people sending urgent messages through this, which they can do in free text boxes. And then the way that we manage the inbound secure messages is through a clearinghouse. So all of the messages, they don't go to individual clinicians. I actually asked the IT staff to turn off all of the psychiatry clinicians for that modality. It goes into a specific mailbox that's monitored by one of our clinicians, someone who's delegated to do that. And that takes a lot of the burden off everyone else, so that when I'm in LA giving a talk to you, I don't have to worry about what's pinging my secure message box right now. So let me demo the system for you. So let me sign in. Take. Okay, let's try it one more time. Do not write this down. Okay, so is everyone familiar with Open Communicator? You can't see it? Oh, okay, let's see. Still no. Let me try one more time. Pardon the technical difficulties. Sorry, folks, just give me 1 second here. Still not there. I'm sorry? Thank you very much. That's not cutting it. Let's try this. I think I need a AV consult. Yeah. I can get online okay. That's not a problem. Somehow it's just not. I tried to change Windows and it bumped me.
So you're not getting back to this?
Actually, I want to be online. It was showing this fine up until I tried to switch to here, and then it gave me a hard time.
Okay.
Okay, I think we're back on track. So are people familiar with Open Communicator? This is part of point and click through which students can communicate with providers and administrators using secure messaging. So when a student logs in, they have to register first and give their email information. So they log in, and then if they receive a message through the Open Communicator, their email gets pinged, and it says something very nondescript like, you have a message in Open Communicator. So then they log into Open Communicator and they can see this is a way to protect their healthcare information. So you can see here, messages is an option, so we'll just click on that. And that takes us here, and we're going to say new message. And this print is pretty small, huh? Can you guys make that out from there? Okay, so we're going to send a message to Psychiatry. And we have a disclaimer here. So this is our landing page, our opening landing page that basically asks the student to read it and acknowledge that they understand that they really don't want to send an urgent message this way, and that anything they type in here is going to end up in their mental health record. Okay. Now, this information doesn't get reported when a release of information request is asked for, but it's sitting in there, and it's discoverable if there is ever a legal action or anything like that. And actually, if the student wanted to see it, we could find it. Yeah, go ahead.
Yeah, just a point of clarification. So, the way our system is set up, students can only respond to secure messages they receive. In this system, can students independently send a secure message if they haven't gotten one?
Yes, a student can initiate messaging here, but they can't initiate messaging to any individual psychiatry staff member. They can only initiate a message to the clearinghouse box. Okay.
That's just how you set up your system.
That's right.
So our system's set up.
Right. Yeah, there are a couple of different ways to configure it. One way is where students can't initiate, but they can respond. You can actually turn off respond, right? So you can only send messages and student can't send messages back. Or you can have it this way where they can initiate. They could even initiate to any provider if we had turned that on, but we didn't. So there's a lot of different modalities back there. Mm-hmm. Not to everyone else. Mm-hmm. Okay. Okay. Vivian? Our IT staff set it up. It's basically a mailbox that they gave a name to, and then they gave permissions to certain staff members to be able to access that mailbox. Yeah, it's pretty easy. Okay, so once the student reads this and they understand, we assume that they read and understood by clicking that they acknowledge that they're not going to send urgent messages, they're not going to, and this is going to become part of their medical record. So there are 4 different options that we felt we could respond to. One is scheduling questions, medication refills, non-urgent questions about medication, and then urgent concerns. I'm going to start with urgent concerns. So if a student says, apparently they read the landing page and they understand that they're not supposed to send urgent messages, but maybe they decide they wanted to do that anyway. These things happen. They come to what's called a terminal page, which basically says, here are your options. Since you have an urgent issue, you can go to the emergency room, you can call the front desk, you can drop in. You have a bunch of different options. You can even go to our web page, and this is a link, so they don't even have to do anything except click on it, for other advice, but you're not going to be able to leave a message for us. Okay. And that gets us away from dealing with coming in on Monday morning and finding out that there was an email, at 2 o'clock in the morning on Saturday that really needed attention. Okay, so I'm going to have to cycle through this each time, so bear with me. Same way and the same disclaimer. Okay, let's do scheduling issues. So one of the things we got the computer to do was triage these sorts of requests. So if the student actually has a scheduling question, strictly a scheduling question, psychiatrist doesn't need to do that. In fact, that's a misuse of our time if we're paging through the calendars trying to find schedules when we have very competent admin staff who are actually better at it than we are from practice. So if they want to do that, they have to let us know, and you can see everything that has a double red star next to it is a forced response. They can't move on to the next page until they fill these in. So they can tell you who their doc is. Is this about an appointment that's already scheduled? Let's say sure. And then they can free text what it is that they need help with. sometimes we'll get a secure message that says, oh, I'm out of my Lexapro, and by the way, I also need a form to give to my professor because I missed class a couple of days ago. These things happen, but usually what happens is we get appropriate responses in here. I have an appointment scheduled, I want to cancel it. I can't come in on Wednesday, I could come in on Friday. Okay. So these go directly to our admin staff. They go to our admin manager, and then she either resolves it or delegates it to one of her staff members. Or I guess if she has a question about things, she could come and talk to me or someone else. And this is what happens if you don't put the appropriate information in. You get a bunch of nasty messages. Okay, we're going to cycle back through. And what do you guys want to see next? Do you want to see refills or do you want to see questions? Refills. Okay. Now again, you can get people who try to game the system. I always admire them because they're ingenious and show a lot of ingenuity. We've had people who we've never seen before. They're not treated in our clinic. Fill this out not appropriately, but fill it out in a way that they could get all the way through and ask for a refill and even get a telephone appointment on the calendar. And when you try to pull up their information and you can't find them, you see that they've never been seen by anyone, you start to ask questions. So we ask a question, is this about a medication refill? Because that's what you're asking for from the last page. If I click no, I could show you, I'm going to save us scrolling through all these again, but if it says no, then it boots you back to the original choices again. So let's say yes, it's about a refill. We have another question for you. Do you have an upcoming appointment? Part of our policy is that we don't do refills unless you have an in-person or at the very least a telephone appointment scheduled with one of our clinicians already. This is to try to keep people from getting the message that they can just call in and get a refill whenever they want. Some people still think that they can do that or still want to do that. I'm thinking about a phone call I fielded a couple of weeks back where the student was pretty irate and said that he had been told that he never needed to come in. He could just call in and get his refills, and why was I harassing him by trying to set up an appointment with him? But we don't do that. So we ask them if they have an appointment scheduled. If I click no here, it will boot them back to the page that we looked at a moment ago, which was the scheduling, so that the admin staff can get them scheduled, and then they can return and ask their question if they'd like to. But let's just say, for the sake of okay, so this person has an appointment. This is about a refill, and this is the page that it comes to. And again, there are a bunch of forced responses where they can let us know, okay, great, you have an appointment, so when is that appointment? Oh, it's today, great. And then they have to tell us, what medication are you interested in? Let's just say, this is not my favorite, I'm just putting it in. Now, they don't have to, they can put as much information as they want in here. If they just tell me which medication it is, I can pull up from their profile what dose is and what frequency and what the SIG is and all that other stuff. So this is an important one because oftentimes, pretty often, we get students calling in saying, oh my God, I'm out of my medication and it's a long weekend and I need my medication, it's an emergency. And when I open up the computer, I see that they have 3 refills waiting for them in the pharmacy. So we ask the students to check with the pharmacy first because they can save themselves a lot of hassle. We even give them the phone number to call. They can call while they're on this page and check. And then we ask them, what's your pharmacy of choice? They can either use the Tank Center Pharmacy, which is the campus pharmacy, or any of the pharmacies around the campus. These are all located within about a mile of campus, I would say. And then if it's none of those, they can click other, and then they can put in more information, so we'll get that. And then we can just call in or fax the prescription, if it's appropriate, to the patient there. And we also put a little message down here. Once you click, we'll process it, give us 3 business days. Usually doesn't take us that long. We encourage the students to check with the pharmacy in 24 hours, but all of that is part of the message that we get to them. We usually are able to respond to these within 24 hours, within a business day. And then the last thing I wanted to show you is about questions, which is similar to the med refills in many ways. Non-urgent questions. Non-urgent questions. Okay, so again, we ask a question. Is this about a med refill? Because if it is, we're going to bounce you to the med refill page. If it's not, then we want to hear what you have to say. Do you have an upcoming appointment scheduled? Let's say yes. So here, again, these are for non-urgent questions. Like sometimes patients will have questions like, is it okay if I take this medication at night, or do I have to take it in the morning? I've been taking this, maybe I changed your medication a week ago, and they just want to chime in and say, hey, I started taking a different dose, and it's working okay, or I'm having this weird side effect, can you explain? That sort of thing. So again, they have to go down and choose a provider, tell us when the appointment is, and then we ask a few more questions, like, would you like to speak with your provider before your next appointment? Because that way we know that when this shows up in the inbox in the clearinghouse, we can forward it to their provider and give them a heads up that the student actually wants a call from you before you're scheduled to see them again, and then the clinician can schedule that as they need to. We ask them what the issue is, they can fill that in, and then we ask them another question. If another clinician is available sooner, would you prefer to speak with that person? More often than not, people say no. They don't really want to call, they just want to log this and they want it brought up at their next appointment. But they're also welcome to say yes, and if they say yes, then we ask our admin staff to schedule them with a telephone appointment sooner with any clinician, whoever's available. And again, we mention to them, just for emphasis, this isn't for urgent needs, and if you're having an urgent issue in red print, here are the things that you can do. And that's pretty much the system. It took us, I think I was the rate limiting step. It took me a while to get up to speed with how to design these pages and that sort of thing. And then once the IT folks put it together, we troubleshot it for maybe a week. One of their staff members tried to break it, and then they gave it to me to try to put in non sequitur responses and see what we got. We got a bunch of different kinds of errors, which we were able to correct. But all told, I think the whole process took net time, probably like 3 weeks, maybe 4 weeks from the get-go to start it, design it, get me up to speed, troubleshoot it, and get it launched. And it works pretty well. I think it's done a good job of alleviating some of the trouble that staff has had with either getting all kinds of secure messages that maybe aren't appropriate and then figuring out how to disposition them, to being concerned about getting secure messages while you're away on vacation or that sort of thing. I think it's been very, very helpful in that sense. And then finally, we'll just talk about workflows very, very briefly. As I said, scheduling requests go to the CPS admin manager. Clinical requests go to this clearinghouse mailbox that's managed by our triage clinician, who's our psychiatric nurse practitioner. When she's on vacation, we delegate it to someone else, or we divvy it up amongst several of us. But we always know who's checking. And then as a fail-safe, and this is really important, we have our CPS manager also check the clinical clearinghouse periodically in case something slips through the cracks. She'll be able to let us know that we need to address and resolve a secure message that's been in there longer than we would like. And that's really the system. Any questions? Yeah.
How long have you been using it?
We've been using it since just at the end, we're on the semester system, so I think it was just at the end of spring 2013 was when we started using it. Maybe in June 2013. So it's been a little bit more than 2 years.
And how many messages per unit time, whatever you do?
That's a good question. I haven't done those metrics. Checking this box usually sits in the psychiatric nurse practitioner's mailbox. She's 80% time, so she works 4 days a week. She checks it daily, except for on Mondays, which is the one day that she doesn't check it. She has allotted in her schedule about 30 minutes each day to check it. Sometimes it takes up that 30 minutes, sometimes it takes less. But there's usually something sitting in there. And we give her 30 minutes because sometimes the requests are a little bit more complex and she needs to do a little bit more delving in to find out, to either get it delegated to the right person or to find out what exactly the student is asking for. Yeah.
Maybe 5 messages a day or something.
You know, like I said, I haven't done the metrics, but 5 messages a day would probably be, that's probably a good average.
Half hour.
Yeah, yeah. Okay.
So yeah, first of all, this is terrific work, and I know how hard these kinds of things are to sort out, so kudos on that.
Thank you.
Really nice job. And my assumption is, or the reason why I'm asking, is that if there was interest, we could get this from you and try to incorporate it into our system.
Yes, yeah. So I spoke with our IT manager, Myra, who you probably know from some of the conference calls and that sort of thing. She's awesome. She knows her stuff, and she's very affable and very, very helpful. In fact, I wanted to have her come and present this with me, but she's on vacation, so she's having a good time. She said, when I talked to her about that, she said that she would be happy to kind of pull together a little kit for people and send it off. I don't know what kind of IT support you have at UCSC, but I'm sure that she could either communicate with them or kind of give them the basics and about putting it together fairly simply.
My other follow-up on that is back to my earlier comment about how our systems are set up a little differently.
Mm-hmm.
It seems to me that we could use essentially the content here, but keep our access system the same. So theoretically, it could only be, they could only respond if you go directly to the clinician,
Mm-hmm.
but it would help to control and structure what information the students were sharing with us and probably do a better job than we're doing now in terms of disclaimers and the like.
Yeah, yeah.
So,
Yeah.
I don't see any problem with that. The system doesn't have to work with your kind of access.
No, and I think, that's one of the beautiful things about it is that you can be as flexible with it as you want. You can basically design your system to make it do whatever you want it to do. In fact, our nurse practitioner, oftentimes, after looking at the message and making sure that there's nothing fishy about it, she might just delegate it to the primary clinician and say, hey, you might want to look at this and deal with it when you get a chance.
One last follow-up. Is it reportable? Like, if you wanted to do a study on what students were checking or that kind of thing?
I don't know. I think there's a way to do that, if I could be a little bit clever about it. I think if you were to look at the mailbox over a specific period of time and check the box that says that you want to see even issues that have been resolved, you would get a whole listing of all of the messages. And you could look at the headings. You could even go through, if you wanted to do a deep dive, you could go through and look at the content of each one and see what people were looking at. Which would be a very, very interesting research project, I think. Although I think not as easy as some of the automated reports that come out of OpenSchedule, which you push a button and it gives you a well-formatted report. I don't think it would do that, but the data's there, definitely. Yeah, John.
So this is for the psychiatry service.
Mm-hmm.
Are there reasons that you're aware of that an analogous system hasn't been set up for the counseling side of the house?
I don't. I actually really strongly recommended that the counseling side do something very, very similar for all of the same reasons. But I think the sense from the counseling leadership at the time was that it wasn't really all that necessary and that we should just go ahead and let people communicate and it'll be okay. So I think maybe I was a little bit more paranoid, a little bit more concerned about those things. And I don't know, I haven't spoken with Gloria about this system since then, so I don't know if she's had a change of heart or not.
It seems like it would be useful for...
I agree, yeah, I think so. One of the discussions that we did have was about the disclaimers, and we agreed that the disclaimers should probably be consistent across units, just so that we're setting the same message. And even in discussion with the IT staff, that the disclaimer should probably be across the organization, should be pretty consistent. So whether you're talking about primary care, urgent care, or the mental health side of the house, that the disclaimers should have pretty much the same terminology with little tweaks here and there to address the different disciplines. But it's just one way to kind of tighten up the organization and make sure that there aren't any, mistakes or errors that could result in somebody slipping through the cracks. Any other questions or thoughts? Okay, thanks. Let me know if you're interested in getting more information about this. I can put you in touch with our IT person, and my email address is tmitchell, just the way it sounds, @berkeley.edu. Okay, thanks.